I've been dancing since kindergarten, so it's been about 10 years. I've been to the Irish Dancing World Championships, and I just love dancing. It's so fun. I feel like I have a close personal connection with her, and I don't have to dumb things down for her to understand. She really knows like what I'm talking about and how I'm feeling.
It's extremely helpful to be a dance teacher, or a dancer for that matter, and go into performing arts medicine, because you see not just the problem and the mechanics of what needs to change, but you also know that there's another aesthetic level, and that dancer has other goals outside of just being pain-free that they need to achieve in order to get back on the stage.
I've been dancing since I was 3 years old. I've trained in ballet, tap, lyrical, contemporary, jazz, and hip hop. My favorite would probably be tap. That's what I travel with the most, and it's what I really love. We wanted someone who would understand what I do, and she'd understand what things I could start doing again, so that was nice to have.
I do Irish dance, and I've been doing it, this is my 8th year. I've been doing it since I was 5, and I really like it just because it's different from everything else.
What I want to stress to dancers is that there is a way to stay healthy. Your body is your tool. That is what you use when you dance. It's just like taking care of an instrument. If you're a musician, you have to make sure that it stays finely tuned. And that's what I stress to these dancers, is to make sure, hey, if you want to keep dancing, this is your instrument. This is what you have to keep up, and make sure that you do everything that you can to keep it working as it should.
So it really helped me because it helped me understand different things that I never really thought of before, like different things I've never seen, that really helps. And I feel like having that one-on-one attention with Sam was beneficial. That way I wasn't in a class with a bunch of people I knew what I had to work on. She tested me on like my weak areas, and then she gave me different exercises and different stretches to do every day and repeatedly. That way I could like build up strength in those areas, which helps me prevent injury, and how to properly prepare to go on stage or go to a practice without not being warmed up.
I danced my whole life. I started out when I was about 3 years old, and I ended up dancing all the way until my 2nd year in college. Unfortunately, I sustained several injuries myself. Had I known everything back then that I know now, maybe I would still be dancing. But I love what I do. I'm glad that I'm able to take everything that I've learned now, and I'm able to incorporate it into my daily life and into my daily workplace to help these dancers out.
One thing I was afraid of losing was my flexibility in my back, because I do have a pretty flexible back, so I was worried I wouldn't be able to have that back again, but I do, so I'm glad about that.
One of the things that I know a lot of therapists do, and that I definitely do in my practice, is that we try to give patients the power and control over their well-being. And with a lot of musculoskeletal and to some extent neurological issues, if they come up, you have a lot of control over what you feel based on the position of your body and how you're using it.
She's helping me get back to where I was, and she's showing me the correct positions, not only for daily activities, but also how I can bring it into my dance life.
The sooner you get better, the sooner you can get back into things, and the longer you wait, the more chances you have of not being able to do competitions, and even in the long run, you could not be able to do anything of what you wanted to do, and that's not worth it.